Hello again, and welcome back to Illinois Senior Living. I'm Brad with Senior Source, and if you're holding a list of communities and you're thinking, what type of place should I even be looking at? This video is for you, because most families aren't overwhelmed by the options. They're overwhelmed because they don't know the difference between all the levels of care, and they're terrified of making the wrong choice. So if that's you, I want you to hear this. You're not behind, you're not failing. This is confusing for almost everyone, especially under a deadline. So the next few minutes are going to give you a clear, simple way to understand the main levels of senior living care and how to figure out what's most realistic for your loved one, so we can make this feel manageable. The big idea here is to think care continuum, not one perfect place. And the shouldn't line is I want you to remember is families shouldn't have to figure this out alone, especially with the clock ticking. And most of the time, the best move is not the perfect building. It's just choosing the right level of care for where your loved one is right now, and then making sure that plan still holds up if they decline a little. So I'm going to walk you through 4 common levels of care: independent living, assisted living, memory care, skilled nursing, often called the SNF. And as we go, I'm going to give you some quick signs that'll point to each one. First level is independent living. Independent living is where for seniors who are mostly independent but just want some simplicity and community. They can live on their own, but maybe they're tired of managing everything. And they're gonna look for a private apartment style type living with some meals, maybe some social activities, transportation, some housekeeping, and no hands-on care. No one to help manage the medications or help them shower or get dressed in the morning. Those communities aren't gonna help them with any type of physical assistance. If they're safe alone and they could take care of themselves, get themselves dressed and get them to the bathroom, and they don't have any major memory issues, that's a really good community for them to look at. If the biggest issue is some loneliness or just maybe the motivation of how life is getting harder, independent living can be a great first step. Assisted living then is for seniors who need help with some daily life. They don't need 24/7 medical care, but maybe you'll hear things like, mom can't do everything on her own anymore because she doesn't need a nursing home though. Maybe she needs some help with getting dressed in the morning, taking a bath or a shower and getting groomed. Maybe she needs help just managing her medication. Maybe meals and supervision supports needed, some staff check-ins, or just ultimately a safer environment. I want you to keep this in mind. Assisted living is not a one-size-fits-all. Some communities can handle higher needs than others. There are some signs though that it might be a good fit. If mom or dad are missing their medications, maybe they're having had a recent fall or a near fall, maybe they're just not taking care of themselves with their hygiene, they're eating less, they're losing some weight, managing things like managing laundry, just getting dinner ready in the evening, or simple housekeeping is becoming a challenge. Maybe the family's now taking on some of this and it's becoming a burden. A good question to kind of ask to kind of cut through some of that confusion is if my loved one had a bad day at home, would that still be safe? And if that answer is not really, assisted living is often the right conversation. Memory care is a specialized type of assisted living designed for dementia-related needs. The big difference is not just that they would forget things, it's now to add some more safety, structure, and supervision for cognitive decline. Memory care typically includes a secure environment to prevent wandering. Their staffs can be trained to help with dementia-related behavior. They're going to be more frequent to cues and a routine with specialized activities, and there's going to be a higher staff to resident ratio. Signs that memory care is a good fit is maybe the wandering or that person may be leaving the house unexpectedly. Maybe they're getting lost, driving, or even walking. It's unsafe for them to be cooking. Maybe we've had some cooking incidents that became kind of scary. Sometimes we see paranoia, agitation, in the evening, getting a little depressed, also known as sundowning. Increased confusion that's creating some safety issues. They'll look fine maybe in conversation, but managing daily tasks is just becoming tough. This is the big one. Many families will wait because they think it's not that bad yet, or maybe we're going to be okay for a little while before we need any further assistance. But We have to remember this isn't about being bad, it's really just about being safe and reducing the possibility of a crisis moment. So, and if dementia's in the picture, the question needs to become, do we need supervision to stay safe? If that's yes, we should probably look at that as an option. Skilled nursing rehabs are often called SNFs, and they are for higher medical needs and medical care. This will include a number of different care options: short-term rehab after hospitalization, physical therapy, occupational therapy, speech therapy, wound care, complex medical oversight, higher clinical staffing. And it's where families will land after a hospital stay, perhaps, or a surgery or a serious health event. And then the discharge planning begins. Signs that this might be a fit is you can't transfer to and from bed or the chair by themselves. We need some nursing level monitoring daily, or their medical needs are just too complex for assisted living. There are some important things to keep in mind as we look for that bridge. A lot of families will assume the SNF is the next step forever, and sometimes it is, but oftentimes it's just a next decision before they can go home safely. And can they go home with or without support then? Do we need assisted living or memory care next is a good question. And then that's also where families can get overwhelmed. It becomes a care level decision under time pressure. And the pressure is usually because insurance isn't going to pay for their stay much longer. So now we have to figure out, can we safely discharge home, or do we need to look at something more permanent? If there's nothing else that you're going to take from this video, I want you to keep these things in mind and ask some of these questions. Are they safe alone for a full day and night? Can we handle bathing, dressing, toileting, transferring, managing medications, and feeding ourselves without any help? Is there any cognition or memory loss that's creating safety risks, such as wandering, confusion, or unsafe choices? Do we have a medical complexity? Do they need nursing rehab care, or is it mostly a lifestyle and daily support? Those 4 questions usually are going to point you to the right level. And once that level is clear, the community options get way easier to narrow down. Here's some reassurance, because this can get emotional. If you feel guilt or second guessing or fear of choosing wrong, it's totally normal. The goal isn't perfection. The goal is choosing the best next step with the information you have today, so your loved one's safe, supported, and your family can breathe again. I'm going to keep this pretty simple and straightforward. If you need some help figuring this right level of care out and which communities actually will fit, please feel free to reach out. If you want a little hands-on help, you can call or text me at 630-835-0355. Once again, I'm Brad with Senior Source. I'm a local, independent senior living advisor. I provide guidance across Kane, DuPage, Kendall, and parts of Will County. I don't want you to have to carry this alone, and I look forward to seeing you in the next video. Thank you.